Good afternoon. I'm Tom Sullivan. I have the pleasure of serving as the president of the University of Vermont. And we're pleased to welcome our distinguished visitors, and all of you, of course, fall into that category today, including all of these wonderful medical students in front of us. We are honored today to have Senator Bernie Sanders returning home to be with us. Secretary McDonald will be introduced shortly, but he is, of course, a veteran himself and a graduate of West Point. And I want to recognize the efforts on behalf of all of our deserving veterans today, because that, of course, is whom we are here to talk about, and particularly with you about their needs. Service to one's country is an exemplary act that we all must appreciate, admire, and respect. Today you will hear about the ways in which those of you who are in the medical profession can give back to our country through careers within the Veterans Administration, broadly defined. The new programs that will be unveiled today provide students the opportunity for loan forgiveness. I'll repeat that again, loan forgiveness.
I don't think they heard you.
While embracing such a rich experience working, helping, supporting our returning service members. I encourage all of you to consider this wonderful opportunity and to ask questions about Secretary McDonald as he is with us today, and we deeply appreciate his presence on campus. As many of you know, Senator Sanders has worked tirelessly over the course of his career in Congress and now in the United States Senate to support our veterans in every way he and our nation can. And for this, Senator, we are very grateful. Please join me in welcoming Senator Bernie Sanders back to the university.
Thank you all very much for coming out for what I hope will be an important afternoon for you. I want to welcome Secretary Bob McDonald to the state of Vermont. I want to commend him for his efforts during his short tenure as secretary. He was nominated by the president not so long ago and took office at the end of July. And since assuming his position, Bob McDonald has been racing all over this country, trying to get a sense of the problems facing the VA and doing a very good job addressing those problems, and I appreciate all that he has done so far. I think many of you are familiar with the fact that, for a start, the VA is the largest integrated healthcare system in the United States of America. In a given year, 6.5 million veterans will make their way into VA healthcare. Today, over 200,000 veterans in 150 major medical facilities, hospitals, including one in White River Junction, and we have some 800 community-based outreach clinics all over the country, including 5 in the state of Vermont. And the first point that I want to make to you is that you have heard about the problems facing the VA, and those are serious problems. And Secretary McDonald is attempting to address them and will address them. But what you may not heard enough about is that if you go out and you talk to veterans in the state of Vermont, and Deb Amder, who's the director of the White River Junction facility, is here today, 9 out of 10 times or more, what veterans will tell you is that when I get into the VA, the quality of care is excellent, and I appreciate the care that I'm getting at the VA in the large medical centers and in the community-based outreach clinics. What you will hear from the Secretary is that in terms of research, in terms of Nobel Prize winners, they exist in the VA. You know, when people put their lives on the line to defend us, all of us, in one way or another as Americans, have a moral obligation to protect them and defend them. Now, one of the major problems facing the VA today, and we saw this especially true in Phoenix and in other areas, not in the state of Vermont, but in too many areas around the country, is the veterans come in and they say, I want health care access. I need some health care. And in many facilities around this country, the simple truth is we do not have enough doctors, we do not have enough nurses, we do not have enough medical personnel to treat veterans, to treat an aging population from World War II, Korea, Vietnam, to treat the new, younger veterans coming back from Afghanistan and Iraq. We just don't have enough medical personnel. Several months ago, as chairman of the Senate Veterans Committee, I worked with people in the House, in the Senate, to put together legislation which will begin addressing many of these serious problems. We ended up with a bill for about $16.5 billion, almost all of it going to improve health care within the VA. $5 billion of that money is specifically targeted to bringing new doctors, nurses, and other medical personnel into the VA. The estimate is that we need somewhere between 20,000 and 30,000 new medical personnel. And a couple of the things that we did, understanding that many of you are going to graduate in debt. How many of you are going to graduate in debt? Raise your hand. All right. And I just talked to a doctor a few months ago. She graduated $300,000 in debt. All right. So many of you are going to be struggling with that. And what we did is double what the VA can offer in terms of debt forgiveness from $60,000 to $120,000 for doctors and for nurses. What we also did is develop 1,500 new residency slots for the next 5 years so people can do their residencies in the VA. Bottom line is that the VA, with its integrated health care, is a good place to work. And also, when you work in the VA, you are doing some of the most important work that can be done by doctors and nurses. Yes, it may not be all that glamorous, and yes, you may not make as much money as somebody on Park Avenue or someplace else. But what you are doing is serving those people who have served us, and that is our moral responsibility. So I want to thank all of you for being here today, and I hope you will give serious thought to joining the VA team. Thank you very much. And without further ado, let me introduce a man who in his short tenure has done a really, really good job in addressing some of the serious problems facing the VA. Please welcome to the state of Vermont, Secretary of the VA, Bob McDonald. Thank you very much.
Thank you. It's wonderful to be here in Vermont, and it's wonderful to be with all of you. I can remember back, of course, it was many years ago, when I was sitting in a chair similar to yours, thinking about what I wanted to do with the rest of my life. And I always have said, in fact, if you go online and you look at some of the leadership beliefs that I have had over my career, it's living a life driven or inspired by a purpose leads to a much more meaningful life than simply meandering through life without direction. And I salute all of you because you are here because you have a purpose. That's why you're going to medical school. You know, when I was young, I was a Boy Scout, and I loved being a Boy Scout. I loved the Boy Scout motto of help other people at all times. I then went to West Point, and I wanted to go to West Point because there were people living in non-free societies all over the world, and I thought by being an officer in the Army, I could help free them. And then when I left the military, I joined the Procter & Gamble company. The purpose of the company is to improve lives. And on any given day, about 5 billion people in the world use at least one Procter & Gamble product. So when the president came to me and said, what would you think about serving again in running VA? I thought, this is fabulous. This is exactly what I want to do. There is no higher calling in the world that I could do than to try to serve the veterans of our country. What I didn't realize at the time was how important VA is to the country and to the medical profession in general. VA has a three-legged stool. The first leg is the clinical support we provide for our veterans. As Senator Sanders said, over 5 million veterans are getting their care from the VA. We have the largest health care system in the country. But did you know that many of the doctors who work in the VA are also teaching in the very best medical schools in our country? Over 70% of the doctors in this country work at the VA, or have worked at the VA, and many of them are on the staffs of medical schools and also working at the VA. So I was out at UC Davis, University of California Davis Medical School, Stanford Medical School. Next week I'm at Harvard Medical School, Duke Medical School. The doctors working at the VA and teaching at those medical schools at the same time. And the clinical work that they do in the VA helps them become even better academicians. So one of the legs is academics. Help training those who train doctors. The other leg is clinical work. And the final leg is the research. We fund a lot of research. And I'm going to tell you in my talk here about some research that we funded around spinal cord injuries. And I defy you to find a for-profit medical company in this country that would invest in solving spinal cord injuries. Having run a large global company, I can tell you if somebody came into me and said, would you like to invest in spinal cord injuries? I'd say, well, how many people have spinal cord injuries? What's the scale? What's the investment? What's the rate of return? And of course, the need wouldn't be great enough for a for-profit institution to invest. But this is the kind of research that we invest in at the VA in order to help the United States. This is the agenda I'm going to follow. I'm going to explain a little bit about the VA, and I'm going to show you some videos that I think you'll find quite compelling. VA is comprised of 3 separate administrations. The first is our Veterans Hospital, or Veterans Health Administration. As Senator Sanders said, it's the largest integrated medical network in the country, 150 hospitals, over 300 clinics, domiciliaries, and many, many other facilities designed to care for veterans. The second is our Veterans Benefits Administration. We provide insurance, we provide home mortgage guarantees, we provide education, GI Bill as many of you would call it, and we provide benefits to those who have been injured while they were in the service and can't perform or can't be employed afterward. And then one that's often forgotten about is our national cemeteries. It's one of our smaller administrations, but it's incredibly important, particularly at a time when a veteran gets to the end of their life. We support the family and we support the veteran in our national cemeteries. The genesis of the VA was really around the Civil War. In President Lincoln's second inaugural address, he said, "We have to take care of him who have borne the battle, he who has borne the battle, his widow, and his orphans." During the Civil War, Americans did not expect the war to last such a long time. In fact, if you remember the history of the Battle of Bull Run, people went out in carriages to watch it occur. But what happened is 750,000 Americans lost their lives. That's over 500 Americans on every day of the war for 4 years. And we weren't ready for it. The government, the country wasn't ready for it. People were literally buried in common graves on the battlefield. They weren't identified. Letters weren't written home. There were no dog tags in those days. When I was in the Army, I wore a dog tag around my neck, and I put one in my boot in case my body got separated. But there wasn't that in those days. And so during the war, President Lincoln actually committed national lands, and Congress committed national lands to cemeteries. They actually exhumed the bodies from the battlefield. They tried to identify them, and then reburied them in national cemeteries. And if you're a student of history and you're interested in this kind of thing, come visit us in Washington. We have all kinds of archives of the work that was done to try to identify these people and get them properly cared for. The other aspect of this that I want to point out is we've changed, or we paraphrase President Lincoln's statement. He said, "To him who have borne the battle." We now say, "To those who have borne the battle and their survivors." Why do we say that? 11% of our veterans are women today, and 15% of the Department of Defense is women. So we need to make sure we're taking care of women today, and this is a big issue for us. We need more OBGYNs. We need more women, more doctors who are specialists in women's health. We need to retrofit our facilities, which were designed for when veterans were only men. So this is a big issue for us, and if you're interested in women's health, please consider joining us. We have these 5 values, as you can see: integrity, commitment, advocacy, respect, and excellence. These 5 values form this acronym of I CARE, and that's why many of us who work at the VA wear these buttons. These I CARE values guide our behavior. They also tell us and guide our behavior in the future. One of the first things I did when I became secretary was I asked every employee in VA to recommit themselves to these values and to this mission of caring for veterans. Next, our clients. We have the very best patients in the world. No matter who I talk to, doctors, nurses, schedulers, people who work at our facilities, they will tell you there is no better patient than a veteran. In fact, many of our people love hearing the stories of our veterans, of their service to our country. And we love caring for our veterans. They're really the very best people in the world. We still care for the descendant of a Civil War veteran. We care for about 100 Spanish-American War descendants. And obviously, we're still caring for people from World War II and from the latest conflicts in Iraq and Afghanistan.
My dad's a doctor, and he takes care of heroes every day. It takes a special person to do what he does. Every day he sees people with different hurts and scars. Small ones, big ones, complicated ones that never go away, and others that are invisible to everybody else. The scars aren't just on the outside. Sometimes, my dad says, people hurt more on the inside, and you can't see those scars. Those scars take a long time to heal. Where my dad works, they make sure to know lots about the veterans they treat. Like where they were hurt, what doctors have tried to help before, the medicines they have to take, and other important stuff, so that they can be taken care of at other VA hospitals like his. My dad always says every veteran should be able to live a happy, healthy life. Because they risk their lives to protect and serve the United States of America. My dad's a hero to a lot of people, but mostly he's my hero. This is my dad.
Thank you, honey. Hey, kids. So who wants to be a doctor? Yeah, you. Tell us why.
There is no higher calling. In terms of facilities, as we said, we have about 150 medical centers. These are large hospital-like facilities, 820 community-based outpatient clinics. But one of the things we're excited about is our mobile health vans that we have now. We're trying to do a better job of getting out in the rural areas. And what you'll find is at the VA, we are on the forefront, and we pioneer a lot of new things in medicine. We're also doing a lot more in telehealth. using the internet as ways to connect with people in their homes or in our facilities, all ways to try to care for more and more veterans. As I've said, as I've traveled around the country, we've had 3 Nobel Prize winning scientists. If you'd like to win a Nobel Prize, please join the VA. We have 7 Lasker Award winners. We've pioneered a lot of the cutting edge of medicine. We were the first to develop an electronic medical record. We're one of the first ones to do a liver transplant, the first to do an implanted cardiac pacemaker. We train over 70% of all U.S. doctors in our facilities. So we're trying to do everything we can to be on the cutting edge of medicine for this country. We developed the nicotine patch. We developed artificial limbs that work based on electronic impulses from the brain. We've identified genetic risk factors. We have one of the biggest databases that exists in American medicine. I think I can say the biggest database that exists. The only database that rivals us is in the UK. So if you'd like to do research, this is a great place to come and do research because of that database. As I talked about telehealth, did you know it was a VA nurse that invented the use of the barcode in order to make sure we keep patients and their medications and their care properly organized in the hospital? It was my thrill to be able to give some awards a couple of weeks ago. We have really the very best people, I think, in American medicine. We have over 340,000 employees, and about 1/3 of all of our employees are veterans. We have partnerships with the very best medical schools in the country, so if you'd like to teach and continue to help create new doctors while at the same time doing your clinical work at the VA or your research at the VA, we can accommodate that. 2 weeks ago, I was able to give something called the Sammy Awards to 2 of our doctors in Washington, D.C. There are 8 Sammy Awards given this year. They're given to people who work in government and have had a huge impact on the American public. VA won 2 of those 8 awards, so we're very proud of these 2 doctors. Bill Bauman and Ann Spungen worked together in our Bronx medical facility. Bill, when he first started out of medical school, worked for one of our Nobel Prize winning doctors there. And early on, he committed his life to spinal cord injuries. Not just trying to figure out how to regenerate a spinal cord, but trying to figure out all of the impacts that occur with a spinal cord injury. As you can guess, if you have a spinal cord injury, your life expectancy is much less than if you didn't. It's not just the spinal cord injury that's the problem. Your gastrointestinal system doesn't work properly, your muscles atrophy, and you get osteoporosis in your bones. There's just all kinds of problems that come with it. Ann and Bill have dedicated their lives to this study, and they've been able to figure out how to offset some of these systemic failures that occur with spinal cord injuries. Let me let you listen to Ann and Bill.
I grew up in a family of 2 physicians, and my father had the incredible opportunity to work here at this institution. From my earliest days, my father would tell me how great the research was at the Bronx VA. One of the primary missions is to provide the highest quality biomedical investigation to improve the health and well-being of veterans, and by doing so, all Americans.
I share the responsibility with Dr. Bauman to help the center find the best way to improve the medical care, health care, and quality of life of people living with spinal cord injury.
The work that we do in our unit is to identify what goes wrong with the body after spinal cord injury, and essentially everything goes wrong.
When someone gets a spinal cord injury, the first thing they're concerned with is they can't walk. But as the years go by, they learn that that's really the least of their problems.
You lose muscle quickly, you gain fat also fairly quickly. When that occurs, it may lead to abnormalities in metabolism. There are no reduced stresses and strains on bone. That reduction in forces on the bones causes severe osteoporosis and may lead to fractures. And pressure ulcers are a terrible problem.
Finding the cure is great, but right now there's a lot of medical problems that have to be addressed in this population to help them have better quality of life. In 2010, there was Dr. Amit Gopher is an engineer out of Israel. He's actually a person with tetraplegia himself. And he had contacted Dr. Bauman to say he has this new exoskeleton called the Rewalk that he wanted to come and show us. And I was completely skeptical. The person that the company brought to walk in the device, I was told was a paraplegic. But I just see this person walking into the ward downstairs to the community day room in this device. I'm told he's a paraplegic, and I'm convinced it's a hoax. But, you know, he walked up and down the halls, and I turned to Dr. Bauman and I said, we're doing this. We have to find out if this is going to help the veterans with spinal cord injury.
The technology for the robotic exoskeleton is game-changing. It is something that permits an individual who has been seated in a wheelchair to stand and to walk. And if you have been injured and you have been unable to stand eye to eye with your fellow human beings, and you can stand up, and then you can miraculously appear to walk, it is an incredibly uplifting experience. We have observed that being up in an exoskeleton makes the gut work again, which is truly remarkable.
And until there's a cure for spinal cord injury, this is probably their biggest hope for being able to walk over ground, for potentially walking down a sidewalk or in a mall, or going to a park with their children even.
There is something special about being afforded the opportunity to broadly assist others. I was taught that if I could contribute to improve the lives of others, provide innovative care, and reduce suffering, then it is a privilege to do so. Federal service allows you to do so in a grand manner.
So when I gave the award to Bill and Ann, we had on stage Dave. He was a former Marine. He had run 6 times in the Marine Corps Marathon, then had a terrible accident and had a spinal cord injury and was in a wheelchair. This year he won the wheelchair division of the Marine Corps Marathon. But one of the things Dave told the audience, and Bill said it in his comments, was while he's very appreciative for the exoskeleton and all the work Ann and Bill have done to help his body operate more consistently, the thing that meant the most to him was to be able to stand up and look people in the eye again. And it was a really, really emotional moment for all of us. So we're not being bashful. We would like you to come work for the VA. Is that clear? Did you miss the message? In case you missed it, we have a special discount going on today. So if you sign up today, we will reimburse you for $120,000 of your medical care. Thanks to the work Senator Sanders has done, it's gone from $60,000 to $120,000. We have more residencies, as he said, for you, and we have all kinds of programs to help make it worth your time to work in the VA. We've got people in the room right now who work at our Vermont facilities. Those who work in the VA, if you'd raise your hand. So they're all down here. Talk to them. This gentleman here is a recruiter, and we'd love to talk to you. We'd love to have you come work the VA. At least try us out and see how we do. Any questions or comments of any of us over anything that we've covered?
Well, Bob, let me just start.
Yeah, Bernie.
If somebody is interested, other than coming up here and grabbing them,
We'll grab them.
Is there a website that has good information?
There is. Just grab one of us. We'd love to talk to you. My email address, robert.a.mcdonald@va.gov. Love to talk to you. Any questions or comments? Oh, come on. Don't be bashful. Yes, sir.
So,
I'm Bob.
I'm Alan.
Alan, pleasure to meet you, sir. You must be a doctor.
Yes.
I can tell. The stethoscope gives you away.
So when I was in New Haven, Connecticut, I was lucky enough to be the VA fellow for my specialty, and we were very nice to get a paycheck that was like it was a tax form from the to meet those folks.
Right.
And thank them for their service and be lucky enough, not because of their service, be lucky enough to be able to go to medical school and to do a residency without serving like so many did.
But you've served.
Well, but not that they did.
You agree, but you shouldn't feel bad. You served.
I thought it was a great experience. It was just a short little shuttle ride from Yale to the West Haven.
Right,
VA.
right.
And here it's a little bit different for our medical students to get experience at the VA because it turns out that Dartmouth basically hijacks the VA.
Dartmouth, is that in Vermont?
So I think, in the spirit of the VA, maybe we should plan some sort of a mission.
Let's do that.
For retaking our.
Yeah.
I sort of feel bad for our medical students.
I don't want. Yeah, I'm with you.
Experience I had, I just wonder how could it be easier for them before they sign up for this to get a VA experience while they're.
Great.
So I'm happy to
Well,
talk.
yeah, come up, use the microphone.
I've never been accused of being soft-spoken.
There's a microphone behind you, Deb.
All right, so I think actually you make an important point that Dartmouth has been a primary affiliate of the White River Junction VA. Well, we have recognized in the past year or so that that's not appropriate, that we actually have an incredibly strong potential affiliate that we do some work with, but we really need to enhance that work here at the University of Vermont Medical School. And so what I can tell you is that we have had actually in recent months a series of meetings with folks from your medical school to talk about additional opportunities. Right now we're very fortunate to have cardiology fellows coming to the Burlington Community-Based Outpatient Clinic. We have a large community-based outpatient clinic here in Burlington, and that actually treats about 5,000 veterans in the area. One of the things that's always challenging is to get specialty care to these clinics. And so University of Vermont Medical School has been gracious enough to open that door initially with cardiology. We actually just had a meeting to talk about the same potential arrangement with dermatology as well as dental services. So you give us a good, important challenge. We take that on, and we will continue to increase those opportunities because we do feel that it's extremely important to the veterans we serve. And also, I have to say that we feel it's very important for all of you to have the opportunity to take care of veterans. So
That's great. Thank you for the question. That's a great question. Other questions, comments? Yes, yes, ma'am.
Do you have summer research programs for first-year medical students involved in the VA?
Summer research programs. If we don't, we'll invent them. So, you know, my point of view on recruiting, I used to run a large company, the Procter & Gamble company, about $84 billion globally. And my point of view was when I find great people, I don't care if they're in high school, I want to start wrapping them up and having them develop internships for them. So first-year internships, that sounds like a great idea. If we don't have them, we'll create them. So let us know and we'll work on that. Yes, sir.
So the UVM Physical Therapy School actually has a very good relationship with the Burlington White River Junction and also in Salt Lake City. And I was wondering if these sorts of benefits are going to be extended to the so-called ancillary health professions, whether it be speech-language pathology, occupational and physical therapy, and sort of where that stands.
So loan repayment opportunities exist for many different disciplines, particularly those where they are difficult and challenging to recruit for. So in White River Junction, we actually have had some challenges recruiting physical therapists, and so we have added that to our list of specialty areas, different disciplines that has that capability. So yes, that is an opportunity that's available. Thank you for asking. We hope you're going to come work for us, because I need some additional physical therapists.
We do. We need a lot all over the country. So, I mean, well, I shouldn't talk about what happens outside Vermont, right? But, we do. We really have big needs. I mean, if you have a need, let us know what it is, and we'll design something to fit your need and fit our need. Yes, ma'am.
I just want to, on that same line of thought, we have students from speech language pathology. We're always looking for placement sites for our students, and the VA is not always welcoming of our students as student practical placements. Students who do a placement at a place like that are often inspired, and then they want to work there.
Absolutely.
So it's really an investment on your part to take our students while they're students.
Good, sir. So you're actually the second person who has raised that issue today. And I can tell you, as the medical center director at the White River Junction VA, I'm embarrassed to hear that because it certainly doesn't sound right. My background's actually social work, so I started in the VA healthcare system at the St. Louis VA as a social work intern. I know and understand the importance and value of us having trainings, and what I can tell you is we will fix that. So thank you.
Thank you. Yes, ma'am.
I'm going to add to that comment on the graduate program coordinator.
You could stand up, so
The nurse practitioner program here, and the last 2 times we have had our students placed at the VA many years ago. We always have a student here at the local VA. However, for the past 2 times that I've called, another problem is with the phone system. But we've been told no, because they just come and then go and they work, get a job somewhere else. So it really fits with what. So again,
we got new leadership here.
And I can tell you that a good percentage of our primary care providers at the White River Junction VA and our community-based clinics are actually nurse practitioners and physician assistants. So again, I'm embarrassed to hear this, but we will make it better.
We were talking earlier with Dean Prelock about the work that we do with doctors who work at the VA and then come back to the medical school and teach, and how valuable that is both for the school and for the VA. And we were talking about the need to create a similar program for nursing. And so we're gonna take that on too and try to figure that out. So again, if you have a need, let us know what the need is, and we'll try to figure something out. Other questions, comments? Yes?
Well, I just want to say thank you both very much for everyone coming in. I worked in research before I went to medical school at the Iowa City VA for 5 years.
Oh, terrific.
And yeah, it was really wonderful. And I just wanted to comment that in that time when I was there at the University of Iowa, I had overheard some med students talking about not wanting to rotate at the VA and having some misconceptions. And as a federal employee, someone who worked at the VA, I knew that the standard of care was actually excellent, and outcomes oftentimes
right.
are actually much better than in the private or public sector. So anyway, I just wanted to comment that I think it's wonderful you're trying to expand information and get medical students more involved. Really, I think it's a really valuable and to train.
What was your research on?
We did health services research, so I ended up doing actually a bunch of hand hygiene and surgical site infection work. Great,
that's very important, as you know. That's terrific. If you'd like to continue it, come on back. No, I mean, one of the things that I know is very important to Chairman Sanders is a problem called hepatitis C. Hepatitis C is a terrible disease. It's a death sentence, used to be a death sentence, and our veteran population has a higher proportion of hepatitis C than does the typical population. There's a new drug that was invented by the Gilead company and a new treatment. In fact, they announced this week that they've been able to go to one capsule. The only problem is that capsule costs $1,000 a capsule, and the treatment is quite long. We at the VA, because of our ability to buy in bulk and negotiate, we get the capsule for $600, $650 a capsule. Our doctors are treating hepatitis C patients and saving their lives. What's happening in the private sector? People are going untreated because insurance companies won't pay for the drug. Now, it's a big issue. It's taking up 40% of the cost of our pharmacy in some places. But
let me just jump in and tell you It's an issue we've got to deal with.
He's working on it.
It is a wonderful drug. Just met a guy yesterday whose life was saved with this drug. The drug company should not be selling a product for $1,000 a pill. VA gets it less expensive. The other point is, on this issue of medication, once you get into the VA, you're going to get your drugs more or less taken care of. Something like 25% of the people who go to doctors in this country, this is how crazy our system is. They go to the doctor writes out a prescription, and you know what happens? 25% of the patients can't fill the prescription because they can't afford it. It's a pretty crazy system. VA does a lot better than that. If some of you are interested in complementary medicine, acupuncture, meditation, how that relates and combines with other healthcare. You know who's leading the country? I was surprised at this. Go to the DOD, go to the VA, and complementary medicine is now an integrated part of their healthcare. Interested in telehealth, because you're living in a rural area, VA is probably leading the country in that area as well. That's my speech, and I'm sticking to it.
It's a good speech. Anything else? We want to thank you all for being here. And again, if you're interested in the VA, please let us know. We'd love to talk to you. Thank you very much.